A 42-year-old woman presents with progressive fatigue and intermittent joint stiffness over the past several months. So this is probably a room question, right? So, I mean, you're thinking about like non-specific symptoms like fatigue, things like joint stiffness. You're thinking like fibromyalgia, like scleroderma, systemic sclerosis. More uncommonly, it could be things like lupus. It's not lupus. I don't know. It could be lupus. Like the first symptom, like you never get it right on. Progressive fatigue and intermittent joint stiffness over the past several months. So we can say scleroderma, fibromyalgia, rheumatoid. Like fibro is probably going to be like the number one, like most common one here. It's not fibromyalgia. Boo. She reports increasing difficulty gripping objects and a sensation. Okay, well they said tightness, so it's definitely scleroderma. It could be cutaneous. Yeah, let's just say scleroderma. Fuck it. Okay. That was so easy. So the tightness in fingers, I mean, you're obviously going to see that just because of like the skin thickening. Episodes where fingers turn white and painful when exposed to cold. This is Raynaud's phenomenon. This can actually manifest in a lot of different rheumatoid conditions, but that is a thing. Thickened shiny skin over the hands with reduced flexibility and telangiectasias on the face and hands. Like, okay. Chest emitting reticular interstitial infiltrates in the lungs, and lab testing shows like the anti-SCL antibodies. So I mean, that was obviously going to be it. 75-year-old man presents with episodes of dizziness and fainting. 75-year-old man, you're more concerned about like cardiovascular conditions, right? So dizziness and fainting in like a 75-year-old man versus like a 25-year-old woman, you're going to have different differentials going into it. Like, I'm not thinking about like syncope or POTS here. Like, I'm thinking like heart failure, aortic insufficiency. Is the answer lupus? This is probably not lupus, guys. Aortic stenosis, maybe. I don't know. Like, it can be anything. He reports worsening fatigue and dyspnea on exertion. Like, it can be like heart failure. It can be so many things. Can you type lupus in the answers for us? You'll never know. Physical exam reveals bradycardia with a heart rate of 35. I'm not gonna say lupus is causing heart block. It's no way. There's no way this is correct. If this is correct, I'm gonna jump. Okay. Okay. He's hypotensive with a blood pressure of 88/40. I feel like is heart block just an answer? Holiday heart, third degree. Yeah, like if he just has like third degree AV block, because with heart failure you'd expect them to be tachycardic, not bradycardic. I'm just gonna say third degree AV block. Nice. Okay, yeah, because it was like following heart failure up until like the hypotensive came up. EKG shows regular P waves and QRS complexes that are dissociated with no relationship between atrial and ventricular rhythms. Like, this is just heart block this is third degree heart block by definition. A tired appearing 6-year-old boy presents with 3-day history of fatigue and decreased activity. Dude, why do I have to do peds? My license doesn't extend to seeing children. 3-day history of fatigue and decreased activity. I don't know. Flu. H-flu. I don't know. Parvovirus. I don't know. When asked where he's feeling pain, he points to his knees, ankles, and abdomen. Joints? Knees, ankles, and abdomen. I feel like this is really specific for joints, but it's like kind of escaping me what this would be. Dengue? I feel like they'd say fever. I'm gonna say dengue. His mother reports a mild cough and rhinorrhea earlier in the week that has since resolved. Is this HSP? Not Hirschsprung. Henlock, Schonlein, Hennock. Yeah, there we go. Hennock, Schonlein. Okay. The IgA vasculitis. Direct immunofluorescence shows IgA dominant immune. Wow, okay. Why are we doing breasts now? God, I hate breasts. Don't clip that one out of context. 46-year-old woman presents to the clinic for a rash on her right breast. Do you think this is actually like a breast pathology, or do you think it's just like a rash pathology? Like, what is a rash? Like, I don't even know where to start with it. I'm gonna say like mastitis, but she's not like breastfeeding age, so I have no reason to think it's mastitis. I can just say cellulitis, right? The cellulitis isn't even a thing here. Allergy, allergic contact dermatitis. Like maybe it's like a bra, right? Mastitis. But like the only thing there is lactational mastitis. So it wouldn't, all right, fine. If it was just mastitis, I would say it, but it says lactational mastitis and she's 46. Like maybe she had a kid really late. All right, fine. Like I told you. Rash is itchy and sometimes painful. It has not improved with topical creams. I mean, contact dermatitis wouldn't improve with topical creams. It would improve with stopping the offending agent, right? Oh, is this breast cancer? Oh, actually, wait, yeah. No, it's not. Erythematous crusted nipple with superficial erosion and no palpable breast mass. Oh, because it's DCIS. Wait, does she have discharge though? Because DCIS is usually like bloody discharge, right? Oh, huh? Wait, what? Mammography reveals a right... What? Hello? Exam shows an erythematous crusted nipple with superficial erosion and no palpable breast mass. But then mammography reveals a right breast mass and thickening of the nipple and areola with an underlying DCIS. Hello? The I don't know. Is there any other breast cancer? Paget's? Oh, wait. That's terrible. I said DCIS on the 4th one, and then it gives you DCIS on number 5. That's crazy. This 55-year-old man presents with several months of chronic diarrhea, cough, and unintentional weight loss. Taco Bell. Sorry, it's not a valid disease. Tapeworm. Tapeworm could be a good one, yeah. Actually, you wouldn't have a cough. You wouldn't have cough with that, but you know what? It's fine. Occasional abdominal pain and worsening arthralgias. Okay. So chronic diarrhea, unintentional weight loss. I'm thinking, yeah, like IBD, but the worsening arthralgias part, I feel like is kind of specific, right? Lepto? Oh, is it leptospirosis? Yeah, leptospira interrogans, because it looks like a question mark. Oh, hyperpigmentation of the skin and mild abdominal tenderness. Okay, hyperpigmentation is pretty specific. Is this sprue, maybe? Tropical sprue? It would also like talk about like travel history or something, right? Iron deficiency anemia. Oh, it's it's not sprue. It's next to it in pathoma. It's the one like on the same Whipple disease. Yeah, there we go. Foamy macrophages. Okay. If I thought of sprue earlier, I would have gotten Whipples earlier. Like, literally, I only think of sprue and Whipples together because they're literally on the same page in pathoma. 24-year-old man presents with area of skin discoloration on his upper chest and back. Tinea corporis? He notices the patches become more noticeable after spending time at the beach. Tinea versicolor? Like corporis, like do we want to go through like Tinea versicolor, Malassezia furfur? Is it maybe talking about like fungus or sun? Is it like a fungal problem or like a sun problem? I don't know. I think it's just a tan. But he has to have something that makes him sensitive to being tanned, right? What makes you sensitive? Upper chest and back. Why would you be sensitive upper chest and back? Should we just keep guessing fungi just because? Tinea versicolor. Wait, it was Tinea versicolor. Dude, Gucci got it right. What the f? Basically, Gucci's a doctor. Shout out to House MD season 5 episode 7. Did you just know that off the top of your head? 24-year-old man presents with unilateral scrotal pain. Okay, well, I'm just gonna say testicular torsion. Oh, man. Mild urethral discomfort and urinary irritation over the past week. Epididymitis? Because he also has like a UTI, maybe? Yeah, right? Yeah, there we go. We got it. Nice. Okay, this one is from my birthday, so I feel like we have to do it. Dude, infant? What the f, man? 3-week-old infant presents to the pediatrician for a routine newborn visit. Her mother reports that the infant appears fussy during breastfeeding when positioned on the right side, but feeds comfortably when positioned on the left. I don't f***ing know. Tongue tie, latch, but why would it be comfortable on the right versus left? Wait, actually, I don't even know where to start with this. Are there any newborn diseases? RH, hemolytic disease of newborn, chlamydia conjunctivitis in newborns? I don't know. Reflux? Can you diagnose GERD in a 3-week-old infant? Ear infection is a good one, actually. Actually, wait. Otitis media? Oh, damn. Physical exam shows a healthy appearing infant with the head tilted to the right and the chin rotated to the left.
10 minutes later.
Oh, okay. Dude, I was so confused with this. Like, healthy appearing infant with the head tilted to the right and chin rotated to the left. I was like, why is the examiner tilting the head to the right and rotating the chin? No, it's Torticollis. Congenital how do you spell it? There we go. 36-year-old man presents to the clinic for headaches. He reports sleeping only 3-4 hours per night for the past 2 weeks because he's busy refining a piece of artwork. So people who are not getting sleep and they're like up all night like doing it's probably because it's like a manic episode. Mania in a 36-year-old man is kind of different though. So he's huffing paint. Oh, actually, yeah, that could be like what do you even call it? Like intoxication? It's not one of these. Does he have mania? They don't have mania. Bipolar? All right, we can put down bipolar. You notice that projects often take him far longer. Okay, this is OCD. It's not? He denies aura, focal neurologic deficits, or other associated symptoms. What? Oh wait, is this OCPD? Because it's ego syntonic? Oh my god, where is Lev? Oh my god, I'm cracked. Wait, I got a psych diagnosis based on the difference between OCD and OCPD. That's crazy. He believes that this attention to detail is necessary and does not perceive his behavior as problematic. So the difference between OCD and OCPD is that the compulsions are ego syntonic in OCPD and ego dystonic in OCD. So if somebody like has a history of just constantly washing their hands and like to the point where their like skin is like flaking and stuff, and they know it's a problem and it like bothers them and it prevents them from like going outside because they have to constantly wash their hands, like that's ego dystonic because they recognize that it's something that's like f***ing up their life. For OCPD, it's a personality disorder. So this is something that's ego syntonic. So this is something that they don't think is a problem because it's part of their personality, right? So that's what the clues are saying here. So he's neatly dressed with a carefully groomed mustache. He has a lack of personal or professional relationships because he can't trust others to do things correctly. And he believes that his attention to detail is necessary and does not perceive his behavior as problematic. This is all just because he agrees with his compulsions and that these are things that he finds like necessary.